Welcome to Startup the Science, a podcast by ENAM, the Innovation Network for Advanced Materials. ENAM brings together companies, researchers, and investors working in the advanced materials space for the purposes of knowledge sharing and collaboration. We do this through our programs, events, and initiatives like the podcast you are listening to. In this podcast, we interview inspirational founders, experts, and investors and get a closer look at what they do. This is your host, Taha Adnan, and let's start up the science.
Fun thing about cars is that whenever they break down, you can always fix them, as long as you have the right spare parts. But with the human body, it's different. When something breaks down, there are no spare parts. I mean, if you're lucky, you can find a suitable donor, but still it's not ideal, as there's always mismatches. But what if we could actually 3D print the right donor tissues out of your own cells, so that your body doesn't even notice the difference? This is exactly what the field of biofabrication is focusing on. But one thing which is crucial to get there is to have reliable, reproducible materials to make the cells printable, keep them alive during and after printing, and these materials are called bioinks. And it's exactly that we are developing at Bioinks.
This episode of Startup the Science was sponsored by Berlin Partner. If you would like to get in touch, please reach out to the ENAM team. Hello, everyone. Welcome back to Startup the Science. It is my incredible pleasure today to welcome Jasper van Hoorick from Bioinks, who is here with us. Jasper, how are you?
Very good, thank you.
Yeah, so for those of you who don't know, Bioinks was an ADMACOM Autumn participant in 2021. So how has it been since the accelerator? How was your experience during it, and how did it impact your company's growth since?
Well, a lot has happened since then. I mean, back then we were still a university project named Expectings, working towards valorization. But since then, we actually got incorporated. We raised capital, and we changed name from Expectings to Bioinks. And currently, we are actually preparing our new labs where we will move to in August. And for us, ADMACOM was a great experience, as it really has helped us getting some insights in the company strategy and especially in the negotiation strategy with the university.
That's good to hear. That's good to hear. Yeah, and how did you come across the idea for Bioinks? Was there a sort of aha moment where you realized that this is the idea you want to work on?
Well, for me, the main reason I started studying chemistry a long, long time ago was because I wanted to make a difference. And I was always fascinated by the field. And then, especially when I heard that you could use chemistry for regenerative medicine applications and biofabrication, I really wanted to make a difference. And during my PhD as a materials chemist, I always focused on developing new materials, new inks for 3D printing. And I had a lot of collaborations with other researchers wanting to use my materials. But what happens way too often in academia is that there's very promising research on the application field,
Mm-hmm.
but it never really makes it further in academia because they are relying on people like me, for example. And then if they want to continue and they need new materials, then the project has finished or the PhD student has stopped, and then it never really takes the next step. So it was actually by thinking about that we wanted to give the right tools, the reliable tools to researchers so they could further build their applications on by offering standardized materials to the field. And that's actually how we came up with the idea of Bioinks.
So, can you tell us a bit more about the bioprinting process and how does it differ from regular 3D printing? Do you require special machinery?
So actually, the bioprinting process is in a way very similar to normal 3D printing processes, but there's many different printing technologies and many different strategies. So the most straightforward one is deposition-based printing, where you deposit your materials from a syringe in a layer by layer fashion. This is very similar as the conventional FDM printers, which a lot of people now have at home. The only difference is that you print from a watery solution in the presence of cells, so you have to make some adjustments there. But then there's other technologies as well. There's a lot of research going to light-based technologies. So, for example, stereolithography or digital light projection. are technologies where you use light to cure a liquid resin, and everywhere the light has passed, your resin will solidify. And in that sense, you can also generate a structure in a layer by layer fashion. And the benefit from this technology is that it has a high resolution. You can go down into the range of a few tens of micrometers. But then the most interesting technology from my personal perspective is multiphoton lithography. So you could sort of call this a bit of an advanced stereolithography. So what you do there is you use a very powerful laser, which has which has double the required wavelength. So you use typically an infrared laser in order to cure a UV curable material. And having double the wavelength means that every photon has only half the required energy. So what you do is you focus your laser. You basically put all your photons or light particles into a funnel, and then when they are concentrated enough, there is a chance that you will have two photons interacting with your material at the same time, thereby
Hmm.
bridging the energy gap. And as a consequence, this is the only technology where your curing is very confined in all three dimensions, which results in extreme high resolutions, so even below the micrometer range.
I see. So you've basically started with normal FDM type depositions, and then slowly, as you move on to these processes, your resolution increases. Is that correct?
Yes, indeed. So it's when you go to light based, your resolution always increases, and then you have yeah, more and more advanced technologies. And now recently, there's actually been a new technology which can be very interesting in the field of biofabrication, which is called volumetric 3D printing. And what you're doing there actually is you use a hologram, which makes your structure appear in a few seconds, in contrast to minutes or hours with other printing technologies, which is very interesting.
And do you foresee the same type of applicability towards bioprinting?
But that technology can even be a lot more interesting because one thing which is important during bioprinting, if you want to print in the presence of cells, is that your cells stay alive during the printing process. And therefore, you typically don't want to print for too long times. So, having a technology like this where you can generate centimeter sized constructs within a few seconds is ideal for cell viability because then they're only out of their normal environment for a short period of time, and you can use them again afterwards.
Interesting. So how do the other methods keep the cells alive for the currently extended periods of time?
Yeah. So what is very important to keep the cells alive is, of course, that they're in an environment which is very cell-friendly. So for us, when we develop a bioink, first thing we look at is defining the maximum concentrations of all the components so that they don't become toxic. So that's the first thing, and that's in a way the easy part. Then you at least know what limits you can work with. But it becomes tricky because certain components become toxic upon irradiation. So it's also very important that during the printing process, when you irradiate, when you start your chemical reaction to cure your material, that you don't generate any toxicity there. So we try to solve that by using clever photo initiating systems and cytocompatible chemistry, basically, for cross-linking.
I see. Yeah, seems to be a very, very intricate process. A lot can potentially go wrong. Yeah, so let's talk a bit more about the types of cells that you can use, perhaps. So, does it have to be the same cell as the organ that you were printing for, or could you use stem cells that differentiate into the organ after printing? How would it work?
So basically, you can use in theory whatever cell type you want. So what you often have to do if you want to produce a complicated structure is you need different cell types on different areas. So then depending on the printing technology, you can have different cartridges with different cell types and print them in between each other, or you can use a combination of printing in the presence of cells of a specific cell type and then cell seeding on top of the structure or inside the channels afterwards. So basically, in that sense, you can use whatever cell type you want. And one cell type which is of course very interesting is stem cells, because certain cell types are very difficult to harvest or are very difficult to cultivate. So in that sense, stem cells can sometimes become the solution to this problem if you can differentiate them into the required cell type.
Yeah, that leads me to possible use cases of this technology. What could you use bioprinting to do?
Yeah, so the dream we all have within the field is also one of the reasons why I wanted to launch this company to help turn this dream into reality. Is that one day we can use this, of course, for regenerative medicine, um, so that you don't need donor tissues, or that whatever injury or disease you have, that you can basically um, replace the damaged tissue with an exact copy, or maybe even an enhanced copy if of course you have some kind of defect, with an enhanced copy in your own cells, so that your body doesn't even know the difference, and you just are good for so many years to come again. But of course, as you can imagine, there are still some roadblocks ahead. There are some technological roadblocks. One thing where everybody's working on is vascularization of the tissue. And the second very important roadblock, maybe the most important one of them all, is the regulatory trajectory, because there is currently not really a regulatory framework for this type of technology. So if you want to get this into the clinic, this also has to be tackled. But fortunately, you can already use this technology for a lot of applications today. And the main application, from my perspective, is everything related to animal-free testing. So if instead of testing your cosmetics or your drugs on animal models, you could test them on 3D printed human models in a way without having to harm animals or humans. So, for example, in the cosmetics field, there's a lot of interest into 3D printed or artificially created skin models, where you can test the compatibility before applying it to actual test persons. So that's the first thing, and then a second thing also related to that is organ on chip technology, where you basically 3D print micro organs to test your components on. And here you could, for example, also use this for personalized healthcare. So imagine you have a complicated brain tumor. Usually, if that's the case, there's not that many different chemotherapeutics that you can try. Usually, when you tried one and it doesn't work, you're already very, very weak, and your chances of survival become very low. So, imagine that you could take a biopsy of the tumor, 3D print this in a chip, and first optimize the treatment on this 3D printed copy of your tumor, see which one works best before trying it on the patient itself.
Yeah, so perhaps just a little bit more on the organ printing application. So normally in transplants, when you put in a new organ in a body, it's immediately rejected, or there's a high chance of it being rejected. With your technology, that would not be a problem. Is that correct? Would you require immunosuppression?
Indeed, so that's a bit the idea, because it would be your own cells. It would be your body wouldn't even notice a difference. But one thing you then need to take into account is that, of course, that the materials that you're using, the actual bioinks, do not have any immune system interaction.
I see.
So therefore, it's very important that they're very reliable, that they're very pure, that they are not contaminated with anything, and that they are very biocompatible materials, of course. So that's the problem shifts from the cells to the biomaterials.
Primarily, that is the solvent itself, right? So what interactions happen with the solvent? Does it? I imagine in a curing process such as photo curing, it evaporates off. But in other cases, does it stay around? How does it interact?
So it depends really a lot on the printing process. But if you're printing in the presence of cells, then the formulations that we are developing or that we currently have, they're hydrogel based, so they're water based. So in that sense, you develop your material after printing using cell culture medium or PBS, and you wash away everything which hasn't been cured. So it all dissolves in the medium. You refresh your medium,
I
and it's
see.
gone. So that's for when you print in the presence of cells and when you're working with hydrogels.
Mm-hmm.
What you can also do, we also have formulations which are biodegradable polyesters, which you typically want to use if you need stronger mechanical properties, like for example in bone regeneration. There,
Mm-hmm.
of course, you print in the absence of cells. So then you first print your construct and you wash away your polyester with an organic solvent.
Mm-hmm.
But what we aim there is to use solvents which are also water soluble, so that even if there's still trace amounts left, you can also wash them away with your cell culture medium, so that they
Okay.
don't remain there. And that's a bit in terms of the used solvents, but also in terms of the materials. The ultimate goal is that we use biodegradable materials,
Mm-hmm.
so that after you implant your structure with the cells, that your cells will gradually degrade the material and substitute it with their own newly formed extracellular matrix, so that after a certain period of time, there is actually nothing left which your body isn't familiar with. So you wouldn't even be able to tell that you ever had a 3D printed tissue there.
Yeah.
So
Mm-hmm.
that's a bit the ultimate goal. And that, of course, brings in another area of complexity, because not only your materials need to be biocompatible, but you also want your degradation products to be biocompatible and to be secreted by the human body.
Yeah.
So this is also something which needs to be taken into account. Then.
Mm-hmm. This is a very sought after thing in regenerative medicine all over, I think. Let's talk a bit about the printing. How do you print hollow structures that have the potential to collapse? Do you require some sort of structures beforehand, some sort of mold?
Yeah, so there it depends again on the printing technology, but this is indeed a problem that customers are facing. So when we are using deposition based printing, so the most conventional printing technology, we actually developed a material specifically for this. It's called supportings, and what you actually do is you print your support structure with it using two print heads, and then once your structure is complete, you can wash the sacrificial material away, and you end
Mm-hmm.
up with your channel. So
I
this
see.
is a strategy in deposition-based printing, but with certain printing technologies, you actually don't really need that. Like for example, in multiphoton lithography or in volumetric printing,
Mm-hmm.
you can print in 3 dimensions within your material. So there you can actually have a gel or solid material, meaning that while you are printing,
Mm-hmm.
your uncured resin is a solid or a gel, and it supports your material which is still being cured. So once it's cured, it's strong, and then you can wash away the uncured resin,
Mm-hmm.
and then that will disappear, and it will leave the voids that you're looking for.
I see.
So depending on the printing technology, you don't even need to have any support structure. You can even um, benefit from that. And it's exactly for that that we've developed some materials, and we actually have a patent on these solid state curable materials, which are a great benefit in this aspect.
I see. I see. And would you say this is your USP? What would you describe your selling proposition?
This is one of the USPs we have. So basically, what we are really focusing on, what we are experts at, is developing these materials for high resolution printing, for multiphoton lithography, which is what is really needed to advance the field, to have this high resolution, to be able to go into cellular or even subcellular dimensions, to mimic the natural complexity of tissues. So this is really where we are strong at, and in that sense, we currently have the only resin enabling printing of living cells with this submicrometer resolution. We also have the only biodegradable, biocompatible polyester-based resin, which can be printed down to a few hundreds of nanometers resolution. And it's actually because of these aspects that we managed to get partnership with the market leaders in this high resolution printing field, being Nanoscribe and Up Nano, who are actively distributing our materials. So this is our main unique selling proposition. But we also have another unique selling proposition in that sense that we are focusing on developing materials for different printing technologies, and we are trying to offer equivalent materials for all printing technologies, so that if a customer or a researcher wants to shift from one technology to the other, that they don't need to start again from scratch,
Hmm.
start with the development, so that they can use the equivalent material from our portfolio, which has the
Hmm.
same quality standards and the same reproducibility um, in that aspect.
I see. I imagine other competitors in the space are very specific with the types of technologies that they support. Correct.
Yeah. So in this field, what happened most of the time is that companies are focusing on building a 3D printer, selling 3D printers, and then they offer some materials as add-ons to the printers. And then since this field is growing and the market is growing, we figured it's difficult to do everything within one company
Hmm.
in that sense. So therefore, we decided, okay, we are experts in the material point. We are experts in the bioink field. So let us focus on this, offering standardized, high quality materials, and we also offer this to companies who build the printers, so that they can rely on developing the best printer in the world without having to worry about the materials, and that we
Hmm.
can just tailor our materials to their printing system, so that the end customer actually get the best solution, gets the best of both worlds. So innovative materials with innovative printers, and that both companies can focus on their core expertise and yeah,
Hmm.
expand in that sense. So that's a bit our reasoning why we wanted to start with this, and why we are also not offering any 3D printers ourselves.
So, as a spin-off from university, is there any advice you would like to give to other founders who are looking to follow the same path? I know we touched upon this in the beginning with a bit about academia, but yeah, perhaps some more insight would be useful.
Yeah. So in that sense, first advice I would say is like, do not hesitate to try to turn your ideas into reality. I mean, that's also how it started with us. I was getting to the end of my PhD, and then having a lot of collaborations, thinking about how we got really nice results
Hmm.
in my PhD research. And then I was thinking like how sad it is that even if you get really nice results, if there's no follow up project, if there's nobody working on it, nobody will bother anymore, because that's often not what university is looking into. They want to do research, and often they don't really care too much about commercialization or getting it into the clinic because it's too complicated or too expensive
Hmm.
or whatever. But they want to sort of incentivize researchers, and I think more and more universities are doing that, meaning that this also gives a lot of opportunities. Like in our case, we could apply for a university grant to
Right.
see if we could turn our technology into a viable product. So in that sense, I would say if you have an idea and if you believe in your technology, if you want to make a difference, start first by looking, isn't there any grant I can apply for? Because then in that sense you can sort of explore your idea in a way pretty risk free,
Hmm.
so to say.
Yeah.
But you have to take into account that this can be a blessing in disguise in a way,
Hmm.
because at the beginning you can always benefit from the technology and the reputation from your university, but you also have to take into account that universities are, their main goal is not necessarily to commercialize products, and in that
Hmm.
sense they can sometimes be tricky to negotiate IP deals with.
I see.
So to tackle this, I would highly recommend to talk to other spin-offs, to other startup companies, and to also engage in events like AdmaCom, which
Hmm.
for us really was a real eye opener in that sense, also to develop our business strategy, and especially for me. I had a very interesting discussion with Robert Harrison,
Mm-hmm.
who really gave me a lot of great insights on licensing strategy and on how to position yourself to university. So I would say talk to as many people, learn from their experience, learn from their mistakes, and sort of take this with you in your negotiations with university.
It's just about taking initiative yourself, and then I think there are quite a lot of sources of help available. Like you mentioned, AdmaCom, the accelerators we run. We also have incubator programs. So that is ideally for people coming straight out of research with an idea. They have 12 months to basically build on that product, and by the end of it, are a fully functioning company. So yeah, the help exists. You just have to be brave enough to go find it.
Indeed.
Yeah, so this will lead me to my last question for today. All disruptive ideas, in my opinion, meet great opposition at the beginning. I'm sure this is something you've seen bringing forward such a groundbreaking company. Do you have any personal philosophies that help you get through tough times as a founder?
Yeah, well, for me, that's also one of the reasons why I wanted to do this and why I'm doing this, because indeed sometimes there are days that you're thinking, why am I making it so hard on myself? Especially if you have former colleagues getting into the easy corporate or easier corporate life, just doing their job, getting their salaries or whatever. But in the end, I mean, it all comes down to, if you've never tried something, you will never succeed. I mean, if you want to make a difference, and if you believe in your technology, and you want to make a difference to society, or even you want to make a difference for yourself, I mean, you can never blame yourself if you tried. Even if you failed, at least you tried. And if you've never tried, maybe you will wonder your entire life, what if maybe I should have tried it back then? What if I had done
Mm-hmm.
that in that case? So that's the first advice I would say. Like, you know, try, especially if you're still young. There's no not that much risk. I mean, you can fail, but you can always try again. And usually, if you've shown entrepreneurial experience, you can still go into corporate, and often that's even seen as like a plus on
Mm-hmm.
your resume. So, okay, worst case scenario, you lose some money over time, but
Mm-hmm.
I mean, there's always ways to make up for that. And then
Yeah.
the other thing I once heard a quote from my uncle's, probably not from him, but it's like, if you are an entrepreneur, this means that you spend part of your life like nobody else wants to, so that you can spend the rest of your life like nobody else can. So that's also a bit like a motivation, like that you remember why you are doing it, because
Mm-hmm.
if you want to make a difference,
Yeah.
you have to go for it.
Yeah. Thank you so much for your time today, Jasper. It was great to have you on the podcast. We wish you the very best of luck as BioInks going forward. And yeah, hope to see you soon.